Hello, dear students. Now we'll be learning the new cement that is zinc polycarboxylate cement. Now this cement is try to find out a cement which had strength of zinc phosphate cement and biological properties like a zinc oxide original cement. So Dr. Smith in 1968 has found out this cement that is zinc polycarboxylate cement. So we'll be learning it under the different heads, introducing the cement, that it is the first dental cement which is introduced as a truly adhesive cement. So this is the first cement which is chemically adhering to the tooth. This is an MCQ question most commonly asked. Invented by Dr. Smith in 1968, and it is widely used as a thermal insulating base also, and it is a luting agent for metallic crowns, bridges, and orthodontic bands. The AD specification number of this cement is 61. Let us see the AD specification number of other cements, that is zinc oxygenol 30, zinc phosphate 96, silicate. Now there are two numbers. Nine is old one is a 9 and the new is a 96, and zinc polycarboxylate is 61. There are three alternate name of this cement, that is zinc polyacrylate, zinc poly C, and zinc poly F. F means the fluoride. Now the introducing the cement in the reaction type, that is acid base reaction cement. It adheres chemically and the effect on the pulp is mild. We have seen this diagram to remember the composition of these five different cements. So this is the third cement which is having a same powder component, that is zinc oxide, and the liquid is a polyacrylic acid. So it can be, you can say as a polyacrylic acid or a polycarboxylic acid. So the composition of the liquid will be the polyacrylic acid with zinc oxide will give you a zinc polycarboxylate cement. Let us see the composition. The powder component consists of zinc oxide, the major ingredient, which is the principal reactor. Magnesium oxide, which decreases the calcination reaction of the centering temperature. Silica and alumina increases the strength. Stannous fluoride improves mixing physical properties, and it also gives anti-carcinogenic property, but only in the initial time. The lipid component consists of aqueous solution of polyacrylic acid having a molecular weight of 25,000 to 50,000 with 30 to 45% of water in it. As this liquid goes, increase in the viscosity as the time passes. So to reduce the high viscosity, the copolymers like itaconic acid or tartaric acid is added to reduce the viscosity. It is available in a powder and liquid form. It is also available in a single component system where the liquid is also added in the powder form after doing it freeze dried, and then it is grinded to a powder form, and it is added into the powder component. And while during the manipulation, it is just mixed with the distilled water. But it is seen that the properties has not been changed by doing such a modification. So this form, the single component system, has not become that much popular. If you see the classification, there is no classification is there for the zinc polycarboxylate cement. So don't want to remember. We have seen the classification of zinc oxidizole, zinc phosphate cement, but there is no classification for zinc polycarboxylate. Now let us see the setting reaction. Yes, it is an acid-base reaction cement. So when the powder and liquid are mixed, when the polyacrylic acid is mixed with the zinc, your powder component, the zinc cations from the powder, it cross-links the polymer chain to the carboxylic group, that is COO group, forming a zinc polyacrylate matrix. You can see the reaction, that is a zinc polyacrylate is formed, which combines with the carboxylic group. Now, in the reaction, this zinc cation, as it is, you can see in the reaction, it is getting combining with the carboxylic group of the liquid. But in the reaction, many of the carboxylic group, they remain as a freely, means they do not combine with the zinc cations, which will give you adhesion with the enamel and dentin, or bonding with the enamel and dentin. Means the same carboxylic group, when means after mixing, once the mix is complete and when you are uh, condensing it to the cavity, how the bonding occurs. So when the mix is placed on the tooth enamel, The tooth enamel, as we all know, it is high in inorganic content, so which contains calcium ions. So the chemical bonding takes place by forming calcium polyacrylate by the three carboxylate group, which are not involved in the setting reaction. So this undergoes a complex reaction with the calcium ions by ionic bonding with the calcium. So this is you can see very well appreciate in the diagram here. You can see the calcium of the tooth enamel get combines with the pre-carboxylic group, which forms the calcium polyacrylate. It gives reaction with the calcium. Now, how the reaction occurs with the dentin? Because in dentin, the inorganic portion is not that much which is present in the enamel. So here the bonding occurs by the two methods. First, you can see in the reaction that the hydrogen bonds are formed between the carboxylic group and the amine group of the dentin collagen. So this is the first reaction with the dentin, bonding with the dentin. And secondly, some ion diffuse from the cement, they allow the bridge between carboxylic group of the polyacrylic acid and the collagen of the dentin. So this way, by the ion diffusion, there's a bridge is formed between the carboxylic group of the cement and the collagen of the dentin. So this way, the bonding occurs with the tooth enamel and the tooth dentin. But if you see the inorganic component of enamel is more as compared to the dentin. So the bond strength of tooth enamel with this cement is more strong as compared to the tooth dentin. Now, how is the microstructure of the set cement? It is similar as we have seen in another cement that the unreacted zinc oxide powder, it is surrounded by the matrix of zinc polyacrylate. So you can very well draw a diagram of this set cement. Now, how the manipulation of the cement will be done? You can use a glass slab or a paper pad. Yes, you can use your mixing paper pad because this is not exothermic reaction. So there is no role, there is no need to compensate the heat or to there should be dissipation of the heat. So you can use a paper mixing pad. You can use either a stainless steel spatula or a plastic spatula. Then the powder liquid ratio for lutein consistency is less, that is 1.5 gram for 1 ml, and powder liquid ratio for the base is little higher, that is 2.3 gram per ml. Now the method is, again the method is a little different from the zinc phosphate cement. In the zinc phosphate we have made different increments like first small, second large, and small increments. So here it is divided into only two increments, that is the one bulk instrument and the two small increments. Means here you can add first time only the cement in a bulk, because there is no release of the heat. It is not an exothermic reaction, so that is not the issue. So to compensation of the heat, so you can add in a bulk the first amount, and then accordingly the consistency required, you will have to keep on adding the cement increment. Now let us come to the properties. The first important property is the biological property. Now it is having a good biocompatibility with the pulp. It is not irritant as we have seen in the zinc phosphate cement. So the effect of the polycarboxylate cement on the uh, pulp is very mild, and this effect on the pulp is very similar to that we have seen in the zinc oxide retinol cement. Now, what are the causes that give you this mild effect on the pulp because of the zinc polycarboxylate? So the reasons are, the first is that the polyacrylic acid is a weak acid as compared to the phosphoric acid. That's why the effect is mild. And secondly, as we have seen in the zinc phosphate, we add the powder in increments because of the heat release. We cannot add much powder in the first increment only, because if you add a more powder, there may be generation of the more amount of the heat. But here there is no release of the heat, so we can add a more amount of the powder in the initial stage only. So there is a rapid rise of the pH towards the neutrality occurs. Then secondly, or the third cause is the large size of the polyacrylic acid in the composition only. we are seeing the molecular weight of this cement, this liquid is 25,000 to 50,000. And if you see the molecular size of the phosphoric acid, it is around 10,000. So if you just imagine dentin tubule if you draw, and if the size of the the phosphoric acid is less, means it can penetrate the dentin tubules. But as the size of the polyacrylic acid is 25,000 to 50, it is difficult to penetrate through the dentin tube. So it cannot go through the dentin tubule. So there is a no any means it will limit the diffusion of this liquid through the dentin tubule, so there will not be any reaction or irritation occurs to the pulp. Then again, one more cause is that this cement liquid is having more attraction towards the protein of the enamel, so it limits its diffusion through the dentin tubules. Means it doesn't go towards the dentin tubules. So that's why, because of all this reason, the zinc polycarboxylate cement liquid cement is having excellent biocompatibility to the pulp, which is because of this. This has become more popular type of the cement. And this is all about the biocompatibility. And again, yes, it is a directly bonding with the tooth structure, like we have seen in the reaction only. In the rheological property, the mixing time is very, very short, that is 30 to 45 seconds. The setting time for luting cement is 6 to 9 minutes, and for the base, it is 3 to 5 minutes. The film thickness of this cement is little the viscosity is more as compared to zinc phosphate cement, but still we can use it as a luting material because it is having a property of pseudoplasticity. Pseudoplasticity means when you press it, it becomes thin in consistency, so you can lute the crown very nicely. If you see the mechanical property of this cement, it is compressive strength is less as compared to zinc phosphate cement. For luting, it is 55 to 85, and for base, it is 70 to 95. The tensile strength is little higher than zinc phosphate cement. It is around 8 to 12 MPa for luting consistency and 9 to 14 for a base consistency. If you see the elastic modulus of this cement is very less, that is 7 GPa. Because of this, this cement is less brittle and it is difficult to remove from the margin once it is set. Now see chemical bonding with the tooth structure. The bond strength, as I said earlier, only the bond strength with enamel is more as compared to the dentin. It is 3.45 to 13.1 MPa in enamel, and in dentin it is less 2.07. This is only because the inorganic content in enamel is more as compared to the dentin. So the bond strength of enamel is more as compared to the dentin. Not only with the enamel and dentin, it also binds to the stainless steel crowns or the chrome cobalt alloys. The solubility and disintegration of this cement in a luting consistency is 0.06%, and for the base it is 0.2%. If you see the thermal property, it is very similar to the zinc phosphate. It is a good thermal insulator. If you see the aesthetic property of this cement, this cannot be used as an interior restorative material because the cement, when it sets, it looks very opaque, and this opacity is due to the presence of the concentrated unreacted zinc oxide powder, which is seen in the which are present as a core particle. So because of this, is it gives opaque appearance, so it cannot be used as an to interior restorative material. So what are the uses of this cement? It is used mainly for the cementation of the cast alloy restoration. It can be also used for the cementation of porcelain restoration or the orthodontic band cementation as a thermal insulating base. The advantageous property of this cement is it is excellent biocompatible with the pulp, as we have seen so many reasons that it is the liquid is weak acid, then there is a rapid rise of the pH towards neutrality, then the larger size of the molecular weight of the polyacrylic acid, so it doesn't diffuse to the dental tubules. The attraction of this towards the protein of enamel, that is enamelin and amalogenin. So all these reasons gives this cement excellent biocompatibility with the pulp. Chemical bonding with the tooth structure. We have seen very nicely how It binds with the calcium of the enamel and the collagen of the dentin to give a chemical bonding with the tooth structure. It is having a good thermal insulating material, can be used as a base very nicely. Freshly mixed cement exhibits shear thinning or pseudoplasticity, although it is more viscous as compared to zinc phosphate cement. But because of the pseudoplasticity, once you press the cement, it becomes thin and it lutes the crown very nicely. Then what are the disadvantages property? You need accurate proportioning. The proportioning, that is the powder liquid ratio, should be correct if you require optimal properties. The need for a clean surface for the adhesion is when you are luting a crown or if you are doing a whenever you're using a zinc polycarboxylate cement, the tooth surface, it should be clean. It should not having any smear layer. So you should clean the tooth surface, or you can use a 10% of polyacrylic acid before. Means you should do the conditioning of the tooth cavity before using a zinc polycarboxylate cement. Then it is having a very short mixing and working time. So you will have to work fast. It is having a low compressive strength as compared to the zinc phosphate cement, and the anti-kerogenic property of it is having anti-kerogenic property, but the property of this cement is not so not so good. It is seen in the or only in the initial period of the restoration or the luting, so it is not longer lasting. So that's why this property is not that much good as compared to the other cement which contains the fluoride in it. So let's come to the end of this cement, that it is the first truly adhesive cement which is introduced. It has excellent biocompatibility with the pulp. The freshly mixed cement exhibits shear thinning or pseudoplasticity property. So these are all about the zinc polycarboxylate cement, which is very short because it is many of these, it is a combining properties that it deals. So it is taken from all these references that I have referred to make this lecture. And the question that can be asked on this is writing details about the composition, role of ingredient, setting reaction, and factors affecting the setting of zinc polycarboxylate cement. Now, the most commonly what I have seen, it is the Viva questions and the MCQ question that has been asked on a zinc polycarboxylate cement. So thank you so much. Uh, and we will see next cement in the next lecture.